I remember a patient, James, who came to see me about 6 months ago. He was 58, fit, successful, and disciplined about everything in his life. He sat in that chair right where I am sitting now, and after a long pause, he said, "Dr. Sofia, I feel like my body is slowly betraying me." He wasn't just talking about fatigue or the gym. He was referring to something deeper, that subtle loss of vitality, the reduced intensity of erections, and the sense that the spark he had always relied on was quietly fading. It is a question many men carry but rarely say out loud. Is this just aging, or is this my new normal? And today I want to answer that question with a gentle but firm no. There are physiological reasons behind what you are experiencing, and many of them are reversible when you understand what is happening inside the body. We are going to talk about something simple, something you likely already have in your kitchen, which when used correctly can have a profound effect on blood flow and vascular relaxation. It is bicarbonate. But it is not just about taking it. It is about understanding why it works and how it interacts with your vascular system, your hormone signaling, and your overall energy production. Before we sit down and go deeper, I would appreciate it if you would let YouTube know this conversation matters to you. Hit the like button, and if you are new here, subscribe so you do not miss future discussions. I also try to adjust the timing of these videos based on when you are most active, so tell me in the comments where you are watching from and what time of day you usually tune in, whether it is early morning with coffee or late at night when everything is quiet. For those of you who are new here, I am Dr. Sofia, a board-certified urologist, and for over a decade my work has focused on men's reproductive health, hormonal balance, and prostate function. In my clinical practice, I have always believed that listening is the most important diagnostic tool. Most men come in expecting to be told to just tolerate their symptoms, but what I do is listen carefully to what is said and what is left unsaid, and then connect that with the underlying physiology. And when we look at declining blood flow, it is rarely caused by a single factor. It is usually a combination of changes that build up over time. Let us start with the vascular system itself. Your arteries are not rigid pipes. They are living, responsive tissues lined with the endothelium, a delicate inner layer that controls dilation and blood flow. When you are younger, that lining is smooth, responsive, and highly efficient. Blood flows easily, and vessels expand when needed without resistance. But over time, chronic inflammation from diet, stress, and lifestyle factors begins to damage that lining. It becomes less flexible, more reactive, and in many cases stiff. This directly impacts vasodilation, the process that allows blood vessels to open properly. And in male sexual function, vasodilation is everything, because an erection is fundamentally a hydraulic event that depends on strong, sustained blood inflow. This entire process is heavily regulated by nitric oxide, a molecule produced by endothelial cells that signals the smooth muscle in blood vessels to relax. As men age, nitric oxide production naturally declines, and in many cases it declines faster due to oxidative stress and metabolic imbalance. When that signal weakens, vessels do not open fully, blood flow becomes restricted, and symptoms begin to appear in multiple areas of the body, from cold extremities to reduced energy and sexual performance changes. So the real question becomes, what is influencing this environment? This is where bicarbonate enters the discussion. The body constantly regulates pH, maintaining a very narrow balance between acidity and alkalinity. However, modern diets high in processed foods, sugar, and excess protein, along with chronic stress, can increase metabolic acid load. The body responds by activating buffering systems, primarily bicarbonate, to neutralize that acid. When the system is under strain, the internal environment can shift in a way that influences vascular tone. In more acidic conditions, blood vessels tend to become more constricted, and endothelial function can become less efficient. Over time, this can contribute to reduced circulation efficiency. I had a patient, let's call him Michael, 62 years old, a business executive under constant stress. He was on medication for cholesterol, monitored his health closely, yet still struggled with low energy, poor recovery, and declining sexual function. We observed patterns suggesting his internal balance was under strain. When we addressed lifestyle factors and introduced a structured approach that included bicarbonate water support in a controlled manner, he reported noticeable changes in energy stability and vascular responsiveness over time. This is not about randomly consuming baking soda. That would be unsafe and can disrupt electrolyte balance, sodium levels, and blood pressure regulation. The clinical approach is measured and precise. In practice, a small amount, typically around 1/8 to 1/4 teaspoon, is used in a large glass of water, often combined with lemon. While lemon is acidic externally, once metabolized, it has an alkalinizing effect due to its mineral composition. This combination is used strategically to support buffering systems without overwhelming the body. Timing also plays a role. In many cases, it is taken in the morning to help neutralize overnight acid accumulation and support early vascular function. It can also be used in the afternoon when energy levels typically dip, and people are more likely to rely on stimulants like caffeine or sugar. This is not a standalone treatment, but part of a broader physiological strategy. Another patient, David, 65, initially came in due to prostate-related symptoms, particularly frequent nighttime urination that was disrupting his sleep. Over time, we also looked at systemic contributors, including inflammation and metabolic balance. As part of a broader regimen, he incorporated these buffering strategies along with dietary adjustments and hydration changes. Within weeks, he reported improved urinary flow and more consistent sleep patterns, which significantly improved his overall quality of life. When we look at James again, the patient I mentioned earlier, he returned 3 months later. His presentation had changed. There was no frustration in his voice this time. Instead, he simply said, "I feel like I have my body back." What improved was not a single symptom, but the overall environment his body was functioning in. Blood flow, energy, and recovery all shifted as the underlying stressors were reduced and physiological balance improved. So as we close this discussion, I want you to take away a few important points. Do not dismiss changes in energy, recovery, or sexual function as inevitable aging without asking deeper questions about what is happening internally. Consider the balance of your body's environment, including inflammation, hydration, and acid load. A simple supportive approach like bicarbonate water with lemon, used correctly and cautiously, may help support that internal balance. And most importantly, have a conversation with your own physician before making any changes. Bring this up, discuss it openly, and be an active participant in your own health. A good doctor will respect that. Taking care of your body is not about dramatic interventions. It is about consistent, informed choices that support the systems working inside you every day. If this resonated with you, share it with someone who might benefit from hearing it. And I look forward to continuing these conversations with you soon.